Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, I would like to ask, since we are ending our 2024 and we are on to a new year, the first question what I would like to ask is that how aware are you people regarding epilepsy? What is the general knowledge, or when you hear, suppose you hear something called as viral fever, public has got a general knowledge and awareness about what a viral fever is. So how well you are aware about epilepsy, that would be a good thing to know so that I could give you more insight regarding this epilepsy as a common man terminology.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah. So generally, to say in simple terms, our brain is like a computer. Brain is the central, you call it a CPU of a computer. The same way brain is the CPU of our entire body. And
Yeah,
brain has got constant electrical signals that are being produced and is being generally distributed throughout the body through what you call as nervous system. So this is what actually, or this simple system is what actually making all the activities happen in your body. So brain is a part where constant electrical signals are being fired, and there are many places or many chances, many instances where there are many misfirings that happen. So in our brain there is already a protective mechanism to counteract these misfirings, but in some instances, to for some persons, these misfirings or this counter defense for these misfirings do get in a misled way, and these misfirings do happen up or do get transmitted to the general body, and that is what you see as seizure. So to generally speaking, each and every one of us are having seizures, but those are being counter-effected or counterfeited by the protective mechanism that are already existing in our brain or nervous system. When some of these misfirings escape those counterfeit mechanism or counter defense mechanism, we do develop seizures. That is the most simplest term that I could explain, I think.
got it. So, my next question would be what exactly is epilepsy then?
So epilepsy is something, a disease. Seizure is a symptom. So epilepsy, we could say it as a disease which produces this seizure. So generally, we neurologists or neurosurgeons tend to term when you have more than two episodes of seizure, then we try to say that you have got some epileptic disorder or something that causes you seizures. So seizure is like a symptom and epilepsy is the disease. Suppose you say dengue fever, where fever
Yeah,
is just a symptom of that disease dengue. The same way, seizure is just a symptom of the disease epilepsy. So epilepsy can be due to different reasons, or epilepsy as such is a disorder or a disease, where seizure is a manifestation of it. You could term it simple that way.
What are the different types of seizures and do they affect people differently?
Yeah, to generally to classify seizures in simple terms, we could say seizures as general seizures or focal seizures. General seizures are those which affects the entire brain, and you will have its manifestation of the entire part of the body. Most of the time, general seizures are what depicted in the movies and films, what you see, because that is the place where public try to see these seizures. So you see the patient with jerking all the upper limbs, lower limbs, hands, legs, and you see some frothy discharge from the mouth. So that is what a general or a simple appearance of a general seizure looks like. Whereas focal seizures are those which is affecting some certain part of the body. There are many classifications for focal seizures, like just myoclonic seizures. There are different classifications. So focal seizures will be classified or confined to one single part of the body or any single part of the body, whereas general seizures usually affects the entire part of the body. And depending upon the different etiologies, these appearances might be different.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Need not be. Generally, when we find in epileptic patients, we try to delineate some of the non-causes. For example, a tumor inside your brain can cause epilepsy seizure or epilepsy. A stroke or a bleed in your brain can cause it. Maybe some infections in your brain can cause it. Maybe some other pathological developmental problems in your brain can cause it. So there are many non-causes for seizure, but always your seizure need not be because of any pathological cause or a non-cause. You can also have undiagnosed or spontaneous seizures, those seizures which are occurring without any specific causes. So whenever you have seizure, we try to evaluate this patient or the particular person in a systematic protocol methodology so that we do not miss any non-causes for seizure or any underlying pathologies. But when you have a seizure, you need not be tensed up that you have got a very serious issue. Sometimes it could be a very insidious onset or spontaneous seizure with no underlying pathologies as per se.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The generally, as I've already said, the seizure that usually present will be in a generalized tonic-clonic form, or what you see, you will be seeing the generalized jerking movements of your limbs as well as hands as well as leg, some frothy discharge from the mouth, as well as there might be some involuntary micturition or defecation from the patient. So generally, when you have these seizures, these particular symptomatology, when you see, you should suspect that it is a seizure that is occurring in that particular patient, and you should rush for the safety of that particular patient. And as I have said, some focal seizures might also present without this typical symptomatology, like the patient might be staring to some place, or the patient will be simply having an absent type of mind. As a patient or a person who suddenly speaking or suddenly engaged in activities, he suddenly goes simply to an absent-minded staring look. That might also be a focal seizure that is present to him. So identifying these symptoms and rushing to the safety of the patient is very essential. This could happen anywhere, maybe in an airport, or when you are in a railway station or in a bus stand, or you are traveling in a bus. These all things could happen to a nearby passenger. So if you are able to identify it, you could very well rush to the safety of that particular person.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah. So what happens is that, as I've already said in the initial, when we started this conversation, the knowledge regarding epilepsy is not that aware among the public. So epilepsy is still taken as a stigmatic thing, where people think that epilepsy, a person with epilepsy, because if suppose we take up an older generation, they thought that epilepsy, a person with epilepsy is actually affected by some ghost or some dead people, some omen. So this is the concept what they earlier had regarding epilepsy, and still even our medical science have forefronted to forwarded or developed so much, but still the awareness regarding epilepsy is not that much. And especially young people who do have epilepsy, their parents tend to hide those epilepsy, and they never try to take up good treatment for that, thinking that if suppose they start the treatment for epilepsy, one notion is that they think that they have to take up the medication lifelong, or once they start the treatment for epilepsy, they'll not be able to stop it. Or if suppose they start the treatment, the parents do get frightened, or they are afraid that their spouse or their children will not be getting a good marriage alliances. So there are many notions, wrong notions, or missed understandings about this epilepsy, about which the public should be made well aware about. So that way we could avoid the stigma and make a good outcome of this epilepsy patient. So the basic or the best thing that I would advise is that if suppose you find or you have a patient, if you have a person with epilepsy, please bring forward them. Please bring to a neurologist or a neurosurgeon. We can diagnose the cause of epilepsy, and with good treatment methodologies, we could give a good outcome life and good quality life to that particular patients. It's not that dangerous as you people might think or be afraid of.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, that's a very good question. Generally, what we say is that more than the drug therapy for epilepsy, most of the time these seizures do have a trigger factor, and it is very essential that we identify these trigger factors so that we can avoid this epilepsy. Most of the time many patients do come to us that, sir, even after taking these anti-epileptic drugs we do have these recurrent episodes of seizures. So why is it happening? The most important cause or the most important thing is that they are not being aware about the trigger factors. So generally there are some trigger factors that could invoke seizure in any particular people, even in a normal person, like sleeplessness, that you are not getting enough good sleep, and heavy tiredness, you are continuously working without having proper sleep or proper rest, hypoglycemia, having not proper sugar or your sugar level is going down, and a deep exhaustion with dehydration. And these are things that could provoke seizure in any normal individual. He did not have any epileptic form disorder. So apart from this, there are some other trigger factors that could provoke seizures, maybe in some patients with some pathologies like some deep sound or some deep flickering lights, like you see some disco lights, which is so disturbing, flickering soft light. All those could also trigger seizures. So most of the time, even if you consume drugs, there are certain trigger factors that could trigger your or induce seizure in you. Suppose you avoid those trigger factors, you could totally avoid occurrence of seizure in your lifetime or in your daily activities, daily life.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yeah. So generally what we advise is that, especially we do have children, those are diagnosed with epilepsy, they do get diagnosed at an earlier age. So it is the children that we usually have with epilepsy. And second group of people are working women or household women that we say they do have seizures. Now the two most important characteristics of these two group of patients, children as well as household mothers are or household women, are that they are most of the time found alone. Children used to play alone in their home, or the household wife or the household women will be alone in their kitchen. So try to avoid sharp instruments or height, high chairs or tables with much heights for children, and try to avoid sharp instruments in kitchen or whatever workplace for this household women, so that whenever they have an unprovoked seizure activity, these items would not be deleterious or harmful to them. And second thing what we would advise is that for those who have seizures, those who are taking medications for seizures, try to inform or give awareness about their disease process to their close circles. Suppose you're working in an office, try, suppose you have friends, you are in a particular office where you have 2 3 co-workers, and I'm a person with a seizure, so I try to inform, or I try to say, give an awareness about my disease process to my 2 3 friends, so that if suppose I do have a seizure, they'll be there to help me out. Otherwise most of the time the seizure activity will be going unnoticed, and that particular person will be lying after post seizure period for a long time. So to avoid that, it is better you inform or you make your friends, close friend circle, aware about your disease, and keep watch out for your disease activity or seizure activity. And one
Definitely.
more thing that would advise is that for these
Yeah.
particular persons not to lock up their toilets or bathrooms whenever they use, because some most of the time seizures do come up inside your toilet. So if you lock up your toilet, then problem is that when you have a seizure activity, it will be very much difficult to access that particular person. So a person with seizure activity, it would be better that they do not lock up their rooms or their toilets if they are alone.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, one thing that what I would like is that, suppose you as a person who is having seizure, he'll not be able to help himself. So when you see a person who is having seizure, the first thing that you would like to you should do is that take up the particular person, try to lie him on left on sideways. Especially it would be better if you make him lie on left side, and try to avoid, and it was a very conventional notion to give some sharp objects or some iron like objects to that particular person's hand. It is a very wrong notion, you should never do that. And try to, the person who is having a seizure will be totally jerking his upper limb, lower limbs, and try so that you secure him, that particular person, to an area which is devoid of any furniture, which is an open space mainly, so that that particular person will not injure his limbs. And especially if you find that that person is holding something, suppose some object or something, try to hold up that particular hand so that that jerking movement will not hurt the particular person and also the person who is trying to help him. And once that particular seizure, usually these seizure episodes do get settled within 1 or 2 minutes, maximum 5 minutes, unless it is a very other type of seizures, it do get settled within a few minutes. So once it is getting settled and one the particular patient who was undergoing seizure gets settled by himself, try to take him to a nearby health facility so that they could give him the next first aid care that is required.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
The final thoughts would be like what I would suggest is be more aware about epilepsy. It's not a bad notion as still the general public do have. I think the awareness regarding cancer, the awareness regarding diabetes, the awareness regarding obesity has grown so much and people are well aware about those conditions. But epilepsy still lacks this awareness and many people with epilepsy, they do not come out. The person or the persons with epilepsy itself do not come out to the public or do not come out for active treatment thinking that they will be subclassified or they will be taken as a second category in the society. So that notion should change. Epilepsy is just a symptom. Like it is, if suppose you have proper control measures, it is nothing more than a headache. It's too simplified to say that way, but still it is like an headache. You can treat whenever you have a seizure episode and you could still lead a normal quality life even with a seizure. There are many doctors and surgeons who do daily surgery even with active seizures. I mean, not in active seizure state, they do have their seizures controlled and they do take up their professional life in a very good way. So seizure or epilepsy is not something that you should be very shamed to comment, but you should open up more and take proper treatment, and all of us should support this particular patient or support this particular person and see them as normal persons, and we should not consider this epilepsy or seizure as a defect or something that to sympathize on. So that is something that we should avoid actually, but rather try to empower and try to encourage them and try to enfront them and make them one among us. That's what I would like to say.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.